Hi everyone, hope all is well. I'm very fine and happy to be here. Today I want us to talk about depression. This is a condition that is little known to many people, and so it's really important that we talk about it. So, in my last video, I talked about the stigma related to depression, and specifically, I related it to the Kenyan situation. And today, I would want us to talk about depression and just define what it is. It's important that people understand what depression is so that you don't say you are depressed and yet you are not. Depression is a mental illness and it's defined by thoughts, feelings, and behavior. Society imagines or says that people who are depressed are weak, which is not true. Sometimes the people who are depressed themselves feel that they are weak. This is not true. This is a disease. This is an illness that someone does not bring on themselves. It's just like any other illness, like diabetes, like hypertension. So nobody brings these things to themselves. Somebody just becomes unwell. Depression doesn't have obvious symptoms, so it's very difficult to understand. Even those who are living with depression might not understand what it is. The people who are depressed know too well what I'm talking about. So our people needs to be educated. Know that this person that you are telling to snap out of depression can't do it. They need support, they need help, and they need treatment. And so we need to know the symptoms of depression. And I'll just talk about that shortly. Their behavior, there are some very unfortunate things that people or society tells people who are depressed. Snap out of it, get out of it, don't pretend. Things that could be very painful, especially if somebody is struggling. The symptoms related to behavior are like social withdrawal, where somebody is alone most of the time, or even if they are with people, they feel alone. They might not be involved in conversation, they're just there, but they really feel comfortable at their own space. I know there are people that are not depressed, but they feel comfortable at their own space. But this is now brought about depression where somebody just wants to socially withdraw. They don't want to be with people. There are also changes in appetite where somebody could be overfeeding or they might not be eating at all or they be eating very little. So this is another symptom of depression. There is a lack of motivation, low energy levels. So these are things to look out for. There are also sleep problems. Some people may suffer insomnia where there is no sleep at all, or some people might be sleeping too much, which our significant others or people close to this person who is depressed might take as laziness. It's not laziness. You can imagine the whole night if you do not slept. In the morning or the following day, you'll be feeling worse because you didn't have any sleep in the night. And this person who is sleeping too much, they'll still wake up and feel like more sleep. So there are those sleep disturbances that those are things that we really need to look out for. We also have symptoms related to thoughts, and an example is poor self-esteem. When you talk about self-esteem, this is one's self-worth, the pricing you put on yourself. If you are to be sold, I'm saying this on a lighter note, how much would you go for? So it's just our worth. Like if somebody is feeling worthless, then it means they have very low self-esteem. So poor self-esteem, the way somebody looks at themselves and just feels worthless, this can be a symptom of depression. There is also loss of interest in regular activities, things that this person really used to love doing. All of a sudden, they are no longer interested. Let me talk about the men. Maybe somebody who used to love going out with the boys in the evening. That's what we call it back here in Kenya. Then all of a sudden, they don't want to be with people going out. They don't want to be partying. things that they used to love. Maybe this person used to love cooking, like I love cooking. They're no longer interested. Things that were very pleasurable are no longer pleasurable to them. Then there could also be thoughts of suicide, where this person always thinks about their death. In fact, today I was just thinking about a friend of mine who's been telling me they're thinking really about their funeral, about dying. And I did want to make a diagnosis because this was not a counseling session. But later, when I thought about it, I feel I need to talk more about depression to my friend, and in a way that I'll not offend them, in a way that I'll educate them and motivate them. And this is what we need to be able to do. So once you see these symptoms, then you can be able to communicate to this person and in a very friendly way, or advise this person to seek help or to see, a professional. Most of the time, the way people are told about seeing a professional is not friendly at all. So we need to be very sensitive how we pass out information. But it's important to be empowered. Once one is empowered with information, then they can be able to pass it out. But how do you pass it? Do you pass it out in a way that this person will reject your information? So let's be sensitive when we are giving feedback. These symptoms that I'm talking about, they must be there at least for a week or more. One might not feel like that just for a day, and you give a conclusion that they are depressed. So the symptoms must last at least for 1 week or more. And one thing about depression, once these symptoms can also be there over weeks or over years. And again, once somebody is depressed, there's a possibility that it might recur again in future. It's very difficult to think about these feelings, these thoughts, these behaviors as symptoms for depression because they're in the head. There are things that you can't really see, but there are things that are in the head. So you might think they are decisions that you're making, but deep down you are depressed. Like somebody can make a decision to end their life, thinking it's a decision that has just come up, but it's the depression that they could be suffering that is causing them to make that decision. The cause of depression is poorly understood, and there are just a few things that it's felt causes depression, and one of them could be genetics. If there have been family members that have suffered depression, there could be a possibility that other family members, people in that lineage, may suffer depression. There are complex chemicals in the brain called neurotransmitters that play a very important role in depression. Um, like if they are very low, then one would be very vulnerable to depression. So one can be given medication by a psychiatrist to increase the levels of the neurotransmitters to be able to support this person who is depressed. Environmental factors are also important in depression. There are certain issues that could trigger depression. Environmental factors could also be a possibility to causing depression, like living in poverty, going through a traumatic event, or stressful situations. If somebody is very stressed, this can trigger depression. But again, we need to understand that depression does not have obvious triggers. So there are things that we cannot really understand very well. Before we end, how is depression treated? Depression can be treated through talk therapy, where this person talks about their feelings. There are things that can be talked about, their thoughts. The counselor or the therapist can talk about maybe some behaviors that they're having. This is what we commonly call counseling, the thought therapy. It's very helpful for a person who is depressed. And we also, when we talk about the talk therapy, that's where we are talking about psychotherapy. It's a lot that is discussed, conversations about the mind. Medication can also be used. So these two can be used individually, There are patients that would only go for talk therapy, and the symptoms of depression would go down or would vanish. There are also those who would use medication alone without talk therapy. But there are those that the two have to be combined, both talk therapy and medication. A combination of both talk therapy and medication works well to eliminate these symptoms that we've just talked about. One of the big no's in treatment of depression is treating it with alcohol or illegal drugs. There are people who've attempted to do this. This is a no-no. Let's no one use alcohol or illegal drugs to treat depression. It will not treat depression, it will make it worse. Depression can be made worse by total social stigma. Depression can be made worse by social stigma. At least that one we had talked about in our last video, but it's something that we need to be talking about every time because it's very rampant. However, love from family, love and care from family, friends, colleagues, and just the society in general can be very helpful in depression. So let's love, let's care, let's show all the love, and let's check on our families and friends so that if one is depressed, we give them support instead of shunning them, because that's what usually happens. People who are depressed are shunned, they are stigmatized, and sometimes they're discriminated and humiliated, which makes their situation worse. So as we end this video, I would encourage anyone who feels they could be depressed, because it's not easy to diagnose depression, to see a professional, see a counselor, see a psychiatrist, share with someone how you're feeling. The earlier treatment starts, the better. Thanks very much everyone for watching this video. It's been nice having you on board. I'm very happy talking about this information, and I invite you to still keep watching my videos. For those who've subscribed, thanks very much for the support and for being part of this YouTube family. So as I end with a lot of joy and pleasure, believing that you'll be able to support people around you. And if you feel you're depressed, seek support, seek help. The earlier the better. Bye for now, and see you in the next video.